Okay.
Okay, Katie's now.
Okay, we're on right now.
Good morning, good afternoon, everybody. We are just waiting for the fabulous Dr. Schmitz to join us. So would love to hear who you are and where you are from. There she is. Good morning, Dr. Schmitz.
Hey there.
Hi, how are you?
I'm well.
Yeah, you look lovely.
Thank you. Thank you.
I have already had technical problems this morning, so hopefully this will go more smoothly. I was just doing webinars and got kicked off Zoom twice, so please, Lord.
Yeah.
What time is it? We have another minute to go. Yeah, I was just asking everybody to kind of send us a little hello. Love to know what brings you here today, what you'd like to learn more about, and where are you from? Where in the world are you during our crazy life as we know it?
While we're doing this, I'll give you sort of a world tour here. Here I am.
Okay, lovely.
This is the Dunedin Inlet. And,
I like that.
And
unfortunately, this was the only corner of our abode that I could get enough lighting and not have too many distractions. But we're going to put the focus on you today anyway. I like that. I need
Australia, right? Or
woo! I like that.
Let's go
go with Australia. Ooh, that's nice too.
Yeah, this is you know, $20 if anybody can figure out where that is. But it's this weird Swiss Bavaria, whatever place that's outside of Prague that doesn't make any sense. It's not the name of it doesn't make any sense.
Well, we have Mary from Maryland, so two Leonards from Maryland, since that's my hometown.
Yeah.
And got New Jersey and San Antonio joining us, and thanks everybody for being here today. And I'll be official. And Dr. Schmitz, are you ready to go?
I am ready to go.
All right, so I have to read because my memory cannot remember all of your accolades, but welcome, Dr. Kathryn Schmitz. And I'm just giving you all a brief description of this amazing woman and her career. She is, correct me if I'm wrong, I'm going from your bio, Professor of Public Health Sciences at Pennsylvania State University College of Medicine. A clinical trialist, and you know, it's because of these amazing exercise trials that you've done and continue to do that we are able to change the life of cancer survivors as they've come to know it. Dr. Schmitz has served as the president of the American College of Sports Medicine and chairs the Global Exercise is Medicine Governing Committee and founder of the Moving Through Cancer Initiative for American College of Sports Medicine. So to name a few, thank you so much for being with us today and taking time out of your busy schedule. Do you want to just add anything to that before we get going with the barrage of questions?
Well, let me introduce you all to the inimitable Andrea Leonard, who largest network of trained exercise professionals who know how to work well with those who live and have had cancer in the United States. You are part of an enviable family if you are a CETI certified trainer. So
thank you.
You have made an enormous difference in the field, Andrea, and I'm sure that I am not alone in that opinion. And so, you know, it's lovely to see, have my own accolades, but we need to make sure we acknowledge yours as well.
Well, I appreciate that. I'll give a quick little preview. So, and may I call you Katie for the rest of
Katie,
okay.
Please.
So I'm Andrea Leonard, and I'm a 36-year cancer survivor and president and founder of the Cancer Exercise Training Institute. And we've unbeknownst to Katie and I, but well, I guess we've known about each other's work, but kind of been working parallel alongside each other from a distance over the last almost 30 years now. And, you know, different, while Dr. Schmitz is doing all this amazing research, I am not a researcher at all, but I took my own needs as a cancer survivor, as well as those of my mom's after her second diagnosis with breast cancer, and realizing that there was this huge unmet need. This is back in 1995. There was no information really out there. The internet was just starting, and wrote the first book, one of the first books on exercises for breast cancer, which was Essential Exercises for Breast Cancer Survivors. And as time went on, as a personal trainer, there were only so many people that I could help. And so my goal became creating an army, if you will, of other trained health and fitness professionals who could work safely, effectively, and confidently with cancer patients during, after treatment, and well into survivorship. And you know, your work along with what I've done and your directory listing, which we'll talk about later, is such an amazing resource. And of course, Cancer Exercise Training Institute has one as well, but we'll talk later today about kind of merging our directories, which will be an amazing resource for cancer patients and survivors. So thank you again for being here, and thank you for recognizing my humble efforts as well. You are a hard act to follow.
I think we're a good team.
Okay, sounds good.
It took us a long time to find each other, but we found each other.
Exactly, and actually it's kind of a funny story, which let's just share real quickly. Regan Fedrick, who has been running Sunflower Wellness cancer program out of San Francisco, came to one of my workshops in 2001 after her friend, who was actually was a mutual friend who had AIDS-related cancer, and they were working together to create this program in San Francisco. And unfortunately, we lost Chris, but his memory lives on through Sunflower and through Regan. And Regan and I reconnected last year, so after almost 20 years, and said, you know, we really need to come together because she's working in a clinical setting. I'm training people more in the fitness end of things. And then she said, oh, by the way, I know Dr. Kathryn Schmitz. And so we all started conversing, and now we've brought in Karen Wonders because Maple Tree Cancer Alliance merged with Sunflower. So I think we really have the best of the best. We've got Dr. Harness and Dr. Willie and all of the teammates and colleagues that you guys bring to the table to really change the face of cancer recovery. And I couldn't be more thrilled to have this opportunity to work along such giants in the field.
And you've got another growing giant on the webinar. I see that Michelle and Elena from Two Unstoppable are on. So
yes, and they are fabulous. Absolutely, back in my hometown as well.
Changing the landscape. They were, you know, made for COVID.
Yes, yeah. So you guys check out the number 2 Unstoppable, and these ladies need all of our support. They are making such inroads and helping people who are suffering with breast cancer. And my mom has been in the DC area her whole life. She now has stage 4 breast cancer. This is her 3rd episode of it. And I really wanted to send her out to meet with Michelle and, you know, have them work with her. But for those of you who are in the DC metro area, I don't know if they reach out beyond that, but you definitely have to check out Unstoppable. Thank you, Michelle. She's on here. Thanks for sharing that. All right, well, let's get started. I have some questions to kind of throw at you that I've prepared you for, but you know, you can elaborate however you'd like. Let's start off with the PAL trial, which I think kind of set the stage for a lot of this. Would you like to explain kind of the essence of it and what the findings were?
Yes. So I actually want to do a brief history lesson because I think it's of interest and it ties back to your timing of starting, and I think it would be of interest to everybody.
Great.
So in the field of exercise oncology actually extends back. The farthest I can go back in a history of, I've written a history as a chapter of the book that I just published. It's a book that's available from Springer. Exercise Oncology is the title. If you want to hear more about it, then get in touch with me, and I can tell you.
Yeah, you can always put the link on here too.
Right, or something. But anyway, so the first chapter is a history of exercise oncology. And so, you know, the first studies that were done obviously were much more, you know, sort of epidemiologic studies, large observational studies. There were some animal studies as well, but the first randomized controlled trials in human beings were done in the late 1980s at Ohio State University by two nursing researchers. By the way, there was somebody who said they couldn't hear me very well. Are you all, could somebody do a quote?
I mean, you are kind of faint, but I
Yeah.
didn't know if that was on my end.
I can't figure out why, or maybe I'll move my computer a little bit. Does that?
Yeah, right now, as you got closer to it, the sound improved a bit.
Okay, all right.
Yeah.
So, so I won't move.
Yeah, that's better, Katie.
Okay, so those two nursing researchers, Winningham and McVicker, did a number of small exercise studies, and you know what they were doing was you know completely you know out there you know for their time. They were asking women who were undergoing chemotherapy for their breast cancer to exercise on stationary bicycles, and they were looking at outcomes that are still outcomes of interest to all of us now. They were looking at function, fitness, fatigue, symptoms, you know, quality of life, and they were finding positive results. Well, there was a review that was done 1 year after you started working in this area, and it was published in 1996, and it was two giants in the field, Christine Friedenreich and Terry Cornier, published this review that was really prescient. It really, you know, talked about what the future could be of the field. And they did a review of the entirety of all of the work in the field to date, four trials. So, you know, there wasn't very much at that point. And what they concluded was we need more research. No big, well, yeah. Anyway, so by the time I did a systematic review in 2005, and we tried to find all of the randomized controlled trials in the field, there were about 23 studies. And by the time we repeated that in 2010, there were 81 studies at that point. And then by 2018, when we did the second ACSM Roundtable, there were 683.
Wow.
So clearly the field has just taken off at an exponential clip, but
Absolutely.
You were really prescient. You were really, you know, you were had a lot of foresight to understand and to see that there was something here when you started working in this area in 1995. So I want to acknowledge that, and I want to use it as a backdrop for talking about the PAL trial. So the backdrop of the PAL trial was, there actually was a study that came right before it that was funded by the Susan G. Komen Foundation, called Weight Training for Breast Cancer Survivors. And in WTBS, which was done when I was at the University of Minnesota, we randomized women to a weight training intervention versus nothing. And we were really interested in breast cancer recurrence biomarkers, right? It was right after the Z11 trial had been published, and you know, it was like 2002, and sentinel lymph node biopsy wasn't that common yet.
Right.
So we were recruiting women, and the medical oncologist I was working with said, oh, you know, you should just recruit women who had a sentinel lymph node biopsy so that you don't have any risk of dealing with lymphedema. And
yeah, right.
And 4 months into recruitment, we'd only found 4 women that had had a sentinel lymph node biopsy. This was in Minneapolis. So, so clearly, sentinel lymph node biopsy had not taken off as a and so we went back and said, all right, well, if we were to open this up to women who've had axillary dissection and we have to deal with this nuisance variable, lymphedema, it wasn't what we were interested in looking at, what do we need to do? So I got in touch with Susan Harris, who's at the University of British Columbia. I got in touch with Leslie Watke, who runs a program called the Recovery Room, which I commend to all of you. She's a PT who was interested in exercise. She's been a friend to exercise oncology for decades. And I said, what do I need to do? You know, what kind of measurements do I need? What do I need to watch for? How do I change the protocol? And I want you to know that at the time that I was doing that, both Leslie and Susan said, oh, they can do
the same thing that anybody else does. You just need to watch to see if there are any changes. That was their opinion at that time. With regard to should the women with lymphedema be wearing a compression sleeve, both Leslie and Susan, were both PTs, and the physical therapist at the University of Minnesota all said, have them follow the advice of their particular certified lymphatic therapist. So they didn't say that you had to wear a compression. They said, do what your clinician tells you to do. Right. So our pilot came back saying, something that was completely the opposite of what was at that point. And we published this paper in 2005. It came back with results that were completely opposite to what the clinical guidance was on the websites for the Susan G. Komen Foundation, for the American Cancer Society, for the National Cancer Institute, for
National Lymphedema Network.
National Lymphedema Network, exactly. All of them said, don't lift anything heavier than 5 to 15 pounds ever again in your life.
Yeah.
Right. And the problem with that, of course, is that no one is writing a script for a personal valet. And, I'll put it this way, my children were 8 and 10 pounds at birth, so I wouldn't have been able to lift my children, much less a grandchild, or grocery bags are typically 10 pounds. A gallon of milk weighs 8 pounds. So these women were being told that they couldn't function in their lives, right? So our results came back, and I can tell you a backstory of part of the results. We had 81 women in that trial, and there was a surgeon. I know who it was because she told me that she was the one that did this later afterwards. But there was a surgeon who was a reviewer for the paper, who basically said, "You have falsely concluded that there is no risk here because you have so many women who are at low risk because they had so few lymph nodes removed." Okay, so she said, if they had fewer than 5 lymph nodes removed, you must remove them from your data set, and then you're not going to have power. Well, turned out we had power, and we were able to publish the paper anyway. The frustrating thing is that one of the women in the control group who had fewer than 5 lymph nodes removed developed lymphedema during the follow-up, and we had to remove her from the cohort. So my point here is that PAL came to pass. It was a trial that came to pass at a time when the field was filled with a lot of conjecture and strong feeling and opinion, and not a whole lot of data. So what we did with PAL trial, this was funded by the National Cancer Institute, was we recruited 2 cohorts of women. One cohort of women had lymphedema walking into the trial. One cohort of women were at risk for lymphedema. We did include women with sentinel lymph node biopsies.
Yeah.
Okay, but we had about half of that, more than half of that cohort had an axillary dissection, so we were empowered to be able to look at things. So we had those 2 cohorts, and then we randomized them within baseline lymphedema status. So the women without lymphedema were randomized to either get the weight training intervention or not. Now, I did this trial at the University of Pennsylvania, and I was really blessed to get to work with a team of remarkable physical therapists at Penn Partners, that now it's called Good Shepherd Penn Partners, right? And, so I had giants in the field of oncology PT. But I will also tell you that they were very different than the team that I worked with in Minnesota.
Interesting.
Because they were insistent that every woman who had lymphedema walking into the trial wear a compression garment while she was exercising.
Okay.
They were insistent that if a woman had a change, that she had to have a new garment, that, there were all kinds of other things that came to play, right? Again, on the basis of no data, but they were not willing to let me proceed in the trial without doing it this way, right? So I did what I had to do. So we got the compression garments donated from BSN Medical, which is jokes, and we randomized them into these 2 groups. The entirety of this trial was the intervention was delivered by fitness professionals at the YMCAs that we worked with. I worked with those YMCAs to train all of those trainers. Okay, there's 17 trainers across 8 different YMCA branches. And you all have worked at YMCAs, you understand what I'm talking about. You know what level of training I was starting with. So it took us 3 full days to train those trainers, to learn how to deliver this protocol. And I was on them like white is on rice to make sure that they were following the protocol and doing exactly what we asked them to do. By the end of the study, just by chance, just so that you know this part of the story, of the 17 trainers that worked with us on the PAL trial, only 2 of them still work for the YMCA. So there's a lot of transiency there.
Yeah, yeah.
So clearly we had to figure out some other way to roll this forward and disseminate it. And we can talk about that a little later, and I hope you'll ask me some questions about it. But I just want to, put that in the hopper.
No, that's great. That's great.
So, so what did we find? What we found coming out of the PAL trial was that the women who already had lymphedema, the likelihood that they would have an exacerbation of their lymphedema that required therapist-delivered treatment was cut in half by doing slowly progressive strength training. The women who were at risk for lymphedema, their risk for developing lymphedema was reduced by 70%.
It's amazing.
Particularly among the women who had 5 or more nodes removed as part of their surgery. So what was the program? That should be of great interest, I think, to the folks that are on this call. So it wasn't magical. It wasn't about, oh, which exercises did she use? I need to use those exercises. That's not the point. That's missing the point, in fact.
Mm-hmm.
So the elements that made this work were severalfold. One, that there were pre-evaluations by well-trained physical therapists and well-trained exercise physiologists. Basically, we were doing a lot of circumferential measurements. We were doing, water volumetry. We were asking them surveys about how their arms felt. So we knew at baseline what things looked like, so that if something shifted, we knew. We asked them at every appointment when they came in to work out with us, have you had a change in symptoms that's lasted a week or longer? If the answer is yes, they didn't do any upper body work, and they were sent off for an evaluation, which means there needs to be kind of a nice little family to make this work, right?
Absolutely.
You've got to have the fitness trainers, but then you've got to have the lymphatic therapist that you're ready to send people to.
Right.
The next element is that all of the trainers, as well as the participants, were educated on the lymphatic system. So I developed a 1-hour-long lymphedema education session, which is now available freely on the close training.
Yeah, and it's wonderful. I was watching it again this morning, just to woo.
Yeah, so
so
it's we recorded that 5 years ago, and it's still fresh as a daisy. So it works really well, and you can send people there. And so the point of that is that it's important for women to understand their lymphatic system so that they know what they're watching for.
Yeah.
So that they understand why they need to take things slowly. And then the final bit is that they had to start low and progress slow. So what we're looking at here is more of a kind of a rehabilitative approach to doing exercise in this population than just, okay, let's couch to 5K, right? So in this situation, what we really need is to understand that you have a damaged body system. And so very much the analogy that I use is one of cardiac rehabilitation. I'll put the link for the lymphedema training video in the chat box by the end. Okay.
Yeah, let me see if I can find it, and I'll share it.
So cardiac rehab. Think about cardiac rehab. You have a damaged body system, the myocardium, right? So do you ask that person to go walk on a treadmill at 4 miles an hour and get to their heart rate, 80% of their heart rate max? No. You work with RPE, you start low, you progress slow, and you let the symptoms be the guide, right? And eventually you go to stage 2 and then stage 3 cardiac rehabilitation, so that they're more and more and more free to work out on their own, and so that they get to the point where they have a level of function, cardiovascular function, with enough cushion in what they're able to do, that you can set them free to do what they want to do. You're not afraid that they're going to hurt themselves. Okay.
Yes.
So, so with the lymphatic system, the issue is that the lymphatic system responds to inflammation very badly. And so this story that I tell is about, probably everybody on this call at some point has overtrained and gotten really sore. And like, you ever had to brush your teeth like this? Right?
Because you can't raise your arm.
You can't, can't move your arm. And it's funny to us, right? It's not funny when somebody has breast cancer. That kind of inflammation is actually a bad thing. So what that means is that in the average person, what we're doing with weight training is micro tears in the muscle, and the muscle repairs itself stronger, right? So that's fine, and that's what we want to do. It's the same thing in this population. The difference is that the slope of the increase is just going to be much more shallow.
Yes.
Right? You're going to get to the same place. It just may take a few months longer.
Well, and I think that, and I don't know what your answer, we'll find out in a second, but in my opinion, in the course of 28 years as a personal trainer, and then of course specializing in cancer and working with hundreds of people, I would say 90% of the people that I speak to, who are not just breast cancer, but any cancer survivors who've had lymph nodes removed, lymph nodes irradiated, any damage to the lymphatic system, they were never told about lymphedema, or they don't remember. I mean, just to be fair, with the mental fatigue and everything, but I think it's so important as those of us who are in the health and fitness field to share this knowledge and to educate cancer patients, because so many of them are completely unaware of it. And when I have somebody, let's say, come into a class or come into training, and they're 10 years post-op or 10 years post-radiation, and they still have a risk of lymphedema, although, maybe it's diminished a little bit, but maybe not. They don't want to hear it 10 years later because they say, oh, well, I haven't gotten lymphedema yet. Can you address that a little bit, and your feeling as far as the education that's made available to patients, and also, what are the risk factors other than lymph node removal, radiation, and there's some evidence to maybe link chemotherapy, but not enough research right now, at least that I've been able to find. What do you think that people need to know? And
right. So it is an ongoing frustration for me, and I think first off, before we demonize anybody for not having done this, and like you say, maybe they don't remember. It's certainly not something that that people want to hear, and and I can tell you that this has been true in my own family. My wife is a head and neck cancer survivor, and it's only because I happen to be living in the same household that I looked at her one day and I said, yeah, you're puffy, you need to go see, and lo and behold, she had developed lymphedema in her face. I mean, who would know?
Right. And oftentimes people do go to the doctor and they're told, oh, it's nothing. It's just a little bit of swelling. Don't worry about it.
So I think that, the field of, I will say that the surgeons don't like to talk about it. I think it makes sense. They feel like, no, there couldn't be lymphedema because I don't want to believe that I've hurt anybody. Okay.
Or they don't want to scare their patients. I mean, who knows? And we've spoken to surgeons, and everybody's got different ideas. We don't know exactly why the message isn't delivered.
Sure. So, and medical oncologists, the problem is that they are inundated with things that they need to be given information. They need badly to have more information. And at the same time, they are inundated with what they have to give patients. The ACOS-CFC requires so much of medical oncology that to ask them to educate their patients on lymphedema is really probably too much, which is why we did the 1 hour thing that we did for close training consulting and made it free. That was very nice of Gunther that he put that up. So I think that education of patients about their lymphatic system would go a huge, long way, Andrea, to helping us to address issues of, why do I need to care about this 10 years hence? And, it could be that you just haven't had the right combination of bee sting, heat,
and sunburn.
Yeah, or compromised immune system. I mean, let's relate it to now with COVID. And when you have well, inflammation is a huge component, you know, kind of in that linear progression towards cancer or other dis-ease in the body. Inflammation is a big thing. And we're speaking exactly about inflammation. You know, what the causes are in this case may be different than somebody, you know, based on dietary or exercise or stress, but all of these things play a critical role. And your lymphatic system is designed to protect your body against infection and other harmful agents. So what happens when you do damage to it?
Right.
And I often use the kind of metaphor or analogy of I-5. You know, everybody can picture, you know, like in California, because we all know how overcrowded California is. And so I'll show a picture of 1 million cars backed up, you know, at rush hour. And what happens if you shut down 2 lanes of traffic? Well, you know, you're going to have a significant backup. But if you shut down 4 lanes of traffic, even more so. And you might have somebody like my mother who had maybe 30 lymph nodes removed 30 something years ago, never had lymphedema. So what do you say to the person who's been getting their nails done, you know, the fake nails with the drilling and the cutting and the clipping, who's never had a bee sting or never had any swelling, and here we are 30 years later, but you still need to be concerned about lymphedema? How do you address that, Katie?
I address that by making sure that they have all of the information, that, you know, educating them about what their lymphatic system does. And, you know, I have a similar, you know, I do I-5. I talk about the highways and the you know, and that there are on-ramps in highways, and that the on-ramps into the lymphatic system highways are bigger than the on-ramps to the, you know, the venous system. As a result, all the big molecules come back through the lymphatic system.
Right.
And as a result, if you have a problem, if the I-5 is clogged, as you say, then you're going to end up with swelling. You know, so you and I have been telling the same stories for
I know.
years.
And you know, this could be Germany, this could be Australia, this could be anywhere. I mean, so Denise Stewart, who is on our board of advisors, she's in, I believe, Brisbane, Australia, and she does scar tissue awareness, and she's done quite a bit in Australia. She's fabulous. And we have a video as part of our training that she's done. And she mentioned something interesting to me. In her practice, she has noticed that there's kind of a peak, if you will, with lymphedema at the 2-year point, where she finds that there's a buildup of scar tissue and adhesions. And so through myofascial release and or, you know, decongestive therapy, being able to release some of that scar tissue, she's seen even lower extremity lymphedema subside almost immediately after she's broken through that scar tissue.
Yeah, absolutely. Absolutely. I think the epidemiologic data would agree. You know, that it tends to increase, incidence tends to increase up to and just past 2 years. And by 3 years out, if you haven't gotten lymphedema, the likelihood that you're going to get it is much lower. That said, is
Hi, puppy. I'm surprised my
son is home from work, and they're very excited about that.
Awesome. It's all right. This is
so, oh, come on, guys, please. Oh. Anyway, you know, I think, you know, what to say to the person who's 10 years out. I think if they know the risks and they choose to, you know, to take the risks anyway, then they knew the risks. And you know,
that's exactly.
That's their prerogative.
Well,
you know?
and in the close video, hopefully I'm pronouncing that right, and this is something that I share with all of the trainers that go through the Cancer Exercise Specialist program, is, you know, we have a page of ways to prevent lymphedema. I'm like, please share this with everybody. And we're actually coming up with rack cards. We've just completed the one for upper extremity, you know, that trainers can put their contact information, not just any trainer, they have to be a cancer exercise specialist, you know, somebody who's capable of working with these people that they can hand out in doctor's offices. But let's talk about some of those things from, you know, you talked about bug bites, bee stings, wearing too tight of restrictive clothing on the affected area. Do you want to go through that list? I mean, I can do it also. But...
Sure. Well, I think that there's something very important, much more than, I mean, people can go find that list. It's, you know, I think that probably there's a concept that's worth talking about
that relates to the list, and that
Okay.
is the concept of overall arm load. And what I mean by that is the lymphatic system takes load. Basically, there is a load on the lymphatic system that is happening at all times. That load goes up. The amount of work the lymphatic system has to do goes up when the arm is overheated, when there is a sunburn, when there is a bee sting,
Yeah.
when there is overwork of the arm,
Right.
you know, where you have, you know, where you've lifted and you're sore, right? When you're impeding the flow of the lymphatic system by wearing clothes that are too tight. But what really seems to be very, very true, Andrea, is that what really matters is when you combine things, when those things get combined. And so the thing to help people to understand is pay attention to what the arm load has been. You know, I'm talking about, I'm used to thinking about upper body lymphedema, so this works for lower extremity
Yeah,
as well.
that's okay.
But pay attention to what the lymphatic load has been before you choose to say, okay, I'm now going to do a weight training workout. Because a weight training workout is going to be an extra load.
Yeah, it's like
So-
icing on the cake.
Yeah. So, so if you choose to retile your bathroom while you're out, your outside bathroom and get a bee sting and then say, okay, this is a great day for me to do weight training, it's just not a good choice, right? The other thing to bear in mind is, your hands in hot soapy water, right? So if you are, an active member of your church and you help with the church dinner and you're doing the dishes, you have just put your, lymphatic system on an extra load. And if you do that and then say, okay, let's go do weight training, you need to pay attention to the combination of things that you're asking your lymphatic system to do, because they all go through the same lymphatic channels.
Well, one of the things that, and I agree wholeheartedly with everything you've said, and throughout the years we've seen, I mean, I remember when National Lymphedema Network said, no more than 8 pounds, you can't get massages, you can't, and all of these things have changed over the years. But let's talk about fitness professionals. So, the goal has always been, I think we probably both shared this, to bridge that gap between the medical community and then fitness or just lifestyle, long-term survivorship. And so, we've got the people doing the research, we've got the doctors who are doing the surgery, we've got people like Reagan and Karen who are in the clinical setting, and all the physical and occupational therapists. And then we have the YMCAs, the Equinoxes, the independent trainers, Pilates, yoga. And many with good intentions are working with cancer patients, whether they were referred by a friend, they happened to go to their studio, and they don't realize the harm that they can do. I mean, we're just talking about lymphedema, and it's a big deal, but there are so many components. And the way I teach the course, like you mentioned, you spent 3 days with people. And, we're doing a university over the course of 5 weeks where we meet for an hour a day. And then they also have their videos and their webinars and 500 pages of material to understand the progression and how to look at things like body composition. Let's talk about adipose tissue. And you've got women or men who are on hormonal therapy, even just, whether it's breast cancer, whether it's prostate, testicular, and they're gaining weight and oftentimes losing lean muscle mass. So we've got this disproportionate body composition as far as, what we call desirable. And what about the extra body fat? I don't know if you tied that into your research, but the adipose tissue tends to retain fluid. And do you see any significance? Because I always put a focus on determining what the most important thing is today. And maybe that is working with a nutritionist or dietitian who specializes in oncology to get, the calories you need, but also, reduce any excess caloric intake so that they can lose body fat, increasing lean muscle, knowing when to refer to a physical therapist or occupational therapist. These are all parameters. But do you put much emphasis on body fat with lymphedema? I know that's kind of especially in the age of body shaming and all of that, taking away from that, from a health perspective, from comorbidities, one being lymphedema, calling a spade, how important do you think that is?
Okay, so we've actually done, the largest trial I've ever done was on this topic.
Okay.
And it was the follow-on to the PAL trial called Wiser Survivor. We published it last August. And it didn't get all the splashy media attention that PAL got, because PAL turned clinical advice on its head, and in a way that people wanted to hear. You know,
Yes.
people wanted to hear, oh, I can do this. Oh, I can, right?
Right.
Well, Wiser Survivor turned clinical advice, or should have turned clinical advice on its head, but it didn't, because people didn't want to hear it. Because what we found was antithetical to what what is the current advice and what people want to believe to be true. And let me explain. So we randomized 351 breast cancer survivors, all of whom had lymphedema, into one of 4 groups: weight loss only, exercise only, the combination, or nothing. And we did a 1-year exercise and/or weight loss intervention. The weight training that we did this time, because of feedback that we got based on what we did in the PAL trial, we were heavily criticized for doing a facility-based exercise intervention that was not disseminable. So we decided to go with a version of the intervention that we had scaled down so that people could do the intervention at home. They did 6 weekly sessions to learn how to do the weight training. They were asked to walk 180 minutes a week, and they were given power blocks, which is adjustable dumbbells, so that they could progress with the weights. And they met with a trainer once a month in order to kind of update and see how things were going. So I'll just tell you that that dose of exercise was insufficient for the changes in body composition that we obtained in the PAL trial. That dose of exercise was insufficient, or that amount of supervision was insufficient to get people to adhere to the program to the level that they did in the PAL trial. So they walked about 120 minutes a week, and they did about 70% of the exercise intervention that we asked, that we prescribed to them. Their weight, the gains that they had in the amount of weight that they could lift were about half of what we saw in the PAL trial. So before I even give you any punchline and tell you about the rest of the trial, what I want to say is that I think it is a cautionary tale. I think that we can criticize something that is a facility-based thing, saying it's difficult to do with lots and lots and lots of people. Let's go with this model where we're virtual, or we're on the phone with people, or we meet with people a few times and set them out on their own. There's a reason why you've trained hundreds of people, Andrea. There's a reason why we need exercise professionals. There's a reason why people need contact with the professionals that you've trained.
Right.
Yes, the program was the PAL program, merely, but it was revised so that they could do it in the home rather than doing it, in the gym. Same education session, same, pre-evaluation by the physical therapist, same lymphedema garments, same exercises, same progression, all of that was the same, but, we need more than, this is just me saying, hey, we need more. Hey, we need more.
Yeah, and Katie, even so, we to date have trained about 11,000 people in 35 countries to become cancer exercise specialists. And then, of course, you have the cancer exercise trainers with ACSM as well, Pink Ribbon Pilates. I mean, there's a number of different programs out there, and all have their merits. There's some differences. There's some, pros and cons, whatever. But the thing that's so important, and I'm currently updating the materials again, which I will hit you up about, the 13th edition. So we update everything every 2 years, just on all the videos, all the pictures, all the information, because the content needs to change with the times. The treatments both for lymphedema as well as, radiation, chemotherapy, hormonal therapy, trial treatments, surgeries, things like Tdap or tug flap that didn't exist 20 years ago. Fitness and health professionals, because just just because you're a physical therapist or an occupational therapist or a doctor does not mean you understand all of the ins and outs of exercise oncology.
Right. Correct.
And that's a hard thing, to grasp, particularly, if you're a physical therapist or you're a DPT, you've gone to school for 6 years. And yes, you are amazing at assessments. And yes, you're great at orthopedic rehab. But unless you've had specialized training,
Right.
and I think the closed program is for PTs and OTs, correct?
No, actually, exercise physiologists can take it as well. You do have to, they basically, if somebody wants to take it and they're not a PTOT, they send it to me and say, does this person have adequate training?
Okay, great.
Anybody who's certified by you would have adequate training.
And that,
Someone did ask a question, by the way, about what's the difference between the free and the paid program. The free program is the thing for patients. The paid program is to learn how to do the program.
and that's breast cancer, correct?
Yes, that's
Okay.
strength after breast cancer. So
Yeah.
anyway, let me tell you about the rest of the trial.
Yeah,
So-
please.
So that's one group. That was the exercise group. Then we had the weight loss group, and I'll just very briefly say we used Nutrisystem. We had behavioral intervention as well. They did beautifully. They lost about 8% of their body weight, which anybody who's worked to lose weight in the past knows is a substantive weight loss. There's not another trial out there that's done as much weight loss with breast cancer patients. Go look it up. We did a great job with replacement foods approach. And what we were looking for was, one of the things that was most disappointing coming out of PAL was that we didn't get any reduction in the swelling. We got reduction in the clinical outcome, but we didn't get any reduction in swelling. So we thought, what if we add weight loss? What if we did weight loss or weight loss plus exercise? And the answer was no. Weight loss will not change lymphedema. So I don't know anything about preventing lymphedema, but I can tell you, contrary to current clinical guidelines on the websites of the Susan G. Komen Foundation, stop me if you've heard this before, American Cancer Society, NLN, NCI, all of them say weight loss will help with lymphedema. I have clinical trial evidence that says no.
Interesting. Well, that's very good to know because, for a cancer exercise specialist, weight loss is important. You can add lymphedema into there, and now you're seeing.
I think it's important for your audience in particular, for a very particular reason, and that is that I think that it's very common for people to, it would be easy to say, oh, well, if you would lose some weight, your lymphedema will get better. And what I'm here to tell you is, no. And so, but exercise will make it feel better. And exercise is going to make your exacerbations go away.
If you do the right exercise.
If you do the right exercise.
Yeah.
Right. So, but the point is, let's focus on the exercise. We know the exercise works. We have evidence, repeated evidence from a number of trials that exercise works. We don't have any evidence that weight loss does anything.
So yeah, and when we talk about weight loss, it's also for comorbidities, because of course you have a higher risk of damage to the heart, damage to the lungs, future risk of cancer, and there for certain cancers, of course, body fat and weight is related to that. At least so they say. Until you do another trial that says no, not the case. But I tell the trainers, although there's benefits to understanding body fat and all, somebody's lost their hair. They've gained 30 pounds, they've lost a breast, and you're going to say, oh, by the way, you have 40% body fat, you need to go on a diet. I mean, that's just not viable. And I know, having had thyroid cancer and struggled with my weight my entire life, and have had some mental disorders, whether you call it an eating disorder or whatever, body dysmorphia, that I know, I'd get on the scale and gain 2 pounds. I didn't care if it was muscle or fat. I was depressed. I was in my bed crying.
Right. No, I hear you. I have Hashimoto's, so I understand.
Okay, we can compare incisions. Well, let's talk for a second. Am I cutting you off? Did we get?
No.
Let's talk about good exercise versus not so good exercise. So we have a lot of people out there, like I said, with good intentions, who are having people recovering from breast surgery doing bench presses with a 45-pound bar when they have upper crust syndrome. Aside from lymphedema, let's talk about, postural deviations, biomechanical issues, range of motion limitations, and that the person who is working with any cancer patient and does not understand all of the acute and chronic side effects, because ACSM put out the most recent findings in 2019, and in a perfect world, those are great. but we still have to be able to, if you're working individually with a person, take all that and disseminate it even further based on that person's individual needs. And that's I think where the cancer exercise specialists can come in, or the cancer exercise trainers, or pink ribbon specialists, whatever. How do you feel about that?
Yeah, no, couldn't agree more. I think that the ideal thing eventually is that every cancer patient lives within a zip code of a cancer exercise trainer. That we have an army, that the proportion of exercise professionals out there who have this specialty training gets above 50%.
Yes.
So get to it, Andrea.
I know, right? I'm working on it. We'll work on it together. Honestly, we've got a lot of people.
But what I would say is that I think that the truth is that that's not where we are. And so we do need programs like Too Unstoppable, which are going to partner people with a fitness buddy. Because in addition to all of the knowledge that you've talked about, the other aspect, of course, is the behavioral side of things, which is, are people willing to actually get off the couch? And so I think that that there is a continuum. I don't think it's an either or. I think there's a continuum. And I think, if we have somebody who is living in a place where the best they can get is a buddy, right, then let's send them out for a walk. Okay, let's send them out for a walk. Let's have them do something that is relatively low risk for them, right? But if we have, if somebody is in a situation where they are either at higher risk, and particularly if they live in a place where they do have access to a PT with specialty training, to one of the folks that you've trained, then I think we can start to get into some individual, because I mean, cancer survivors, you've seen one, I mean, they all have their own particular story and journey.
And then, so that's one of the things that's really, hit home with me over the last 25 years of doing this, is that no two cancer patients are the same. Their response to treatment is going to be different. Their diagnosis, their emotional, their physical, there's so many different components. And to be able to, even in a group setting, figure out a way to segue people in, and certain skill sets of the instructor to create a safe environment that will still cater to each and every individual. And yes, there are benefits to all forms of exercise for a multitude of reasons, but we can do better. And I think that's what you're saying. And the beauty now with everything going virtual is I can train somebody anywhere in the world.
That was my next comment.
Okay, good. Go for it.
Is to partner with folks who are smart about how to make how to make those connections. Because I think that the idea that, oh, well, I live in West Virginia, there's not going to be anybody near, I don't, but, oh, well, somebody lives in West Virginia, there's not going to be anybody near me. Well, it shouldn't matter because they can get online and train with them.
Absolutely. So tell everybody about your directory.
Okay.
We'll have a talk today about, kind of merging our directories.
Okay. So actually there's more to this than the directory. So there's an initiative that we've started at the American College of Sports Medicine called Moving Through Cancer. It is the mission of Moving Through Cancer to make exercise standard practice for all people living with and beyond cancer. And we have, at this point, what we've done so far is we have developed a strategic plan. We are attempting to publish our strategic plan so that it's out there, so that folks can choose to, join us. We are seeking funding from a pharma company to have staff who will assist us with all of our goals. We hope to do a review of all of the policies that are out there that have some kind of import for us to be able to achieve the goal of exercise being standard practice during and after cancer treatment. We're interested in increasing the proportion of fitness trainers, exercise professionals who have specialty training in cancer. We're interested in educating healthcare professionals. We're interested in educating and partnering with fitness centers, with fitness companies,
You and I have talked about that, Andrea. Yes, I still need to send a few emails. Sorry.
That's okay. That's okay.
Anyway, so those are our goals. But one of the things that we wanted, and I can tell you, I'm actually in the process of working with a regulatory organization right now on the possibility of trying to set something up so that in the setting of breast cancer, that women would automatically be assessed, advised, and referred to exercise or to rehabilitation as needed. And in the process of doing that, one of the things that we're uncovering, not surprisingly, is that the clinicians want specifics. When we say, tell your patient to go exercise, they want to know, well, what do you define exercise and where am I sending them? They want to know, because what they're used to is not go chemotherapy. They're used to 800 micrograms per kilogram of, doxorubicin, 400, they're used to precision, right? So they want that kind of precision when it comes to exercise. And so what we've developed is a registry. So it's the Moving Through Cancer registry. And the idea is to have resources that patients and clinicians can use. And we want it to be extremely populated. And so the idea that I brought to Andrea was, let's populate it with everyone with a certification from CETI.
Yeah, and we have a directory on our website also, but yes, the more the merrier.
Right. So, yeah. And,
I'm having a conversation with Ken Germano, who used to be the president of American Council on Exercise. He has a group, he was mentioning, I could be getting it a little bit wrong, but of 1,000 medical, doctors who are very interested in being that other end of this. And so we're going to have a conversation on Monday. I think we're all working for, that same goal is, you've got this pool of people here, you've got this pool of people here, and there's this moat in the middle. And without being, cliche, we really do need that bridge. And unfortunately, it's taken us 20 years to come together, but we're here now. And, you take a bunch of strong, powerful, passionate people, Alana, Michelle, yourself, myself, Reagan, Karen, all the doctors, and we can move mountains, and we will. I know we're getting towards the end of our time, so I want to open this up to some quick questions. I know there was just a question, Katie, about will virtual sites be listed?
Yes, Kathy. Yes, we're actually changing the entire website because you and one other person wrote in and said, are you going to have on, two organizations wrote in with their online, and we don't have a Too Unstoppable up there yet, Michelle.
I think they should be listed on our directory, but yes. So for anybody who is a cancer exercise specialist through CETI, make sure we have your directory info so we can pass it on to Katie. And then of course, anyone else who, I don't know do you have any criteria that you want to?
Yes. So yes, actually the one criteria is that we're not listing anything unless there is somebody who has specialty training.
Ta-da!
Yeah. So
yeah, and we, just as far as Cancer Exercise Training Institute, we'd love for you to join us. Like I said, we're doing live universities right now, virtual live, where we meet for an hour a day for 5 weeks. We have, home-based study. And I know, there are other programs. There's ACSM, there's Pink Ribbon Pilates. Each of them offer their own, their own, I don't know what you call it. They all add to it. But I can tell you we've got, a huge amount of content. Katie, you've seen it. And I think you saw a version that was probably a decade old also. So we are going to be releasing the brand new content over the next couple months.
Yeah.
Really exciting.
Funny story for those on, I think I've told Andrea this, but funny story, like a decade ago, before I had met her, and I didn't know her, and I wanted to see the materials. And I had a roommate at the time who was a yoga instructor who wanted to learn how to be a cancer exercise trainer. And I said, why don't you go take that?
I'll pay for it.
Because I wanted to see the materials.
I know. And I bought ACSM's materials. I mean, that's just Pepsi and Coke.
Yeah, exactly. Well, and honestly, it was great. And I read through them and thought, oh my God, these are fantastic. So,
well, I'm excited for you to see the new stuff. And you guys, I know there's like a bunch of things in the chat box. Katie, I don't know if you've been able to keep up with it. We've got the link. You guys check the chat box, please. That's where the link is for close. And Michelle and Alana, if you want to put again in the chat box the link for To Unstoppable. And okay, you already answered the question about the free versus the paid.
Yeah, there was a question I'll just finish up with. There was a question about, can our services be offered by insurance carriers or physicians? Physicians can refer to you, yes, of course. At this time, we do not have any licensure for exercise professionals to be able to be paid for by third-party payers. There are differences of opinion about whether that would be a good idea or not. Yes, everybody can see To Unstoppable, Michelle. Oh, that's interesting. Some people are not seeing everything in the
Yeah, Sherry Hunt is asking what counts for specialized training. She has a master's degree in kinesiology. Thesis involved breast cancer and exercise intensity.
Yeah, it'd be specialty training.
And that would count?
Yeah. Yeah.
So one of the things with the cancer exercise specialists is we require people every 2 years to get the new updated material and retest, which can be a pain in the butt. Go ahead.
Guys, I just saw this. I'm just realizing that you can say to all panelists and attendees, or you can say to all panelists only. And so if you do to...
Oh, I see. Okay.
Everybody sees. So I just reposted the close training website in case you want to see that.
Okay, great. Yeah, just kind of along the question that somebody just posed about, having done the study on breast cancer and being a kinesiologist, all of that, this is my opinion, all of that is great. But as I said, everything changes. So I think to be reevaluated every 2 years is not a huge task to elevate the level of credentials for the people, whether you're a kinesiologist, whether you're a physical therapist, occupational therapist, even a doctor, let alone yoga, Pilates. And that's in order for Katie and Moving Through Cancer, or in order through the Cancer Exercise Training Institute to kind of put our stamp of approval, there's got to be some substance to that, and the willingness to work and stay current with that information. So I just want to put that out there and emphasize it. We have ongoing trainings, and even this interview with you, Katie, is so valuable, and it will be shared with our cancer exercise specialist. And even if it's nothing more than just to reiterate what they already know and say, good job, you're doing a great job, that carries a lot of weight.
Yeah. You are doing a great job. Keep going. Keep going.
Yeah. So to everybody out there who's doing the work, thank you so much. We will do a follow-up email to everybody on the list, and I can, any links you want me to share, Katie, just go ahead and email to me. We'll add them. I can't thank you enough for being with us today. Jansen Moser's on here. She just popped up. She's the one who's designing the rack cards for the lymph drainage exercises. And Jansen, can you share with everybody, although not everybody's going to be able to order these, okay? You'll have to show that you have credentials, like Katie's speaking of, but share with them where they can order these rack cards, if you would, Jansen. She created a website just for that, and we will be having the lower extremity ones done very, very shortly. So anything you'd like to say in closing, Dr. Schmitz?
I just want to acknowledge that what we do is very, very special. And I know from personal experience, but also the experience of the trainers that have worked with me over the years, that, working with cancer patients ruins you for pretty much working with any other population, because they're very special.
It is absolutely true. And I know a lot of people who are joining us, whether you are, a patient or a survivor, or you are a patient survivor who's also a health or fitness professional, or you have a loved one like your wife, we all have our reason. This isn't something you just go, ooh, 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 me, I remember Vinnie Barbarino, like, I want to do it. They'd much rather do BOSU or kickboxing or something fun. Cancer is not fun, but gosh, it's so rewarding when you really, really change lives. So
thanks for all you do, Andrea. Thank you.
Thank you, Katie. And we will call me whenever it works for you today, and we'll get on that directory.
All right.
Bye,
Thanks so much. Bye-bye.